Great. Welcome, Fran, first, and then Emma. Thank you.
Right. Hi. Well, hi, everybody. And as we said, we are going to get on to the challenges, but both Emma and I are here to talk to you about how we implemented the system of using wipes into Southampton Hospital. We're a really large hospital. We've got 1,400 acute beds. We're a regional centre for many different specialties. And originally, when I heard about waterless bathing, it was from a lecture given by Lisette Schoenhoven, who was president of the EPUAP at the time. And she's done a lot of research at rolling out this wipes-based system in nursing homes in the Netherlands. Now, to be honest, when I heard about it, I was very much of the point of view, no, I don't like that idea. Before Tissue Viability, I was an elderly care nurse and sister and worked in elderly care for over 15 years. And if you weren't going to that bed soaking wet and soaking, you were not going to your patient. So it had to be a lot of convincing for me as well. But what we found, we had a few issues in the hospital. So the first issue that we had with washing with the water, that infection control came forward and they found some issues with bacteria in the sinks in the bays. So we weren't allowed any longer to throw water following a wash down the sinks in the bays, which made it very difficult for the nurses. They were having to open up the bay doors, carry bowls of water from the sluice down to the room, wash the patient, take it all the way back. They weren't able to really change the water in between when they were doing the wash, and there were lots of issues there. We also had issues with our towels laundered and sent into the hospital, and they are quite rough. So we were seeing a lot of patients weren't happy with the towels either. And quite often what was happening is that the hands and face wipes that were being used around the place for up before meal times were being used to clean patients. So we decided to see what the wipes were going to be like. So we did a very, very quick time and motion study. So the tissue viability team took a bay of 6 patients up on one of the elderly care medicine for older people wards, and we went in, we washed all of the patients with soap and water one morning, and the next morning we used the bed bath wipes. And what we found was that we saved over 40 minutes using the wipes than we're using the water. On 6 patient washes, we saved over 40 minutes. So firstly, that was great from a nursing point of view and for a time saving point of view. The second thing is the patients the second day when we were using the wipes were literally saying, oh, this is so much nicer, they're so soft, lovely not to have to be scrubbed with wet, cold water. So we started to get a feel that this might be a good way of going forward. We then, as a trust, went about finding the right wipes, and that was a bit of more of a challenge. Infection prevention wanted us to ensure that we had a wipe. If we were changing a system, we had to have a wipe that contained chlorhexidine at the right percentage to enable us to continue with our MRSA decontamination process. So we looked around and we found that the set of wipes made by Gama Health had both the bed bath wipes, the chlorhexidine wipes, which are used for bed bathing as well. And also an added bonus is we took on the Contiplan wipes, which are for incontinence. And we'll talk a little bit about them a bit later. So what did we do next? We had to then approach lots of staff who didn't like the wipes and didn't like the idea. And we had a lot of words bandied around like festival wash and that's never going to clean the patient, and that's not a proper wash. So I'll just hand over and I'll let Emma explain her opinions at the time as well.
Hi, so yeah, as Fran said, it was a big change in culture for all of us, and I was of the opinion, as a lot of people were, how can you possibly wash a patient without hot soapy water and towels, and how we've done it for years and years. So really, Fran was really helpful, and I know with lots of us that were quite anti the approach, we had trial packs of the wipes. We tried them out on each other. So I got my nurses to try them out on themselves. We did, and realised actually you felt clean after them. So went ahead with Fran's support and started to implement them. Some nurses felt that they might be seen as lazy, not washing the patients properly, but we never had any of that feedback from patients. And, you know, for me as a ward leader, it was really important to get on board with such a big change in culture and try and understand and believe in it so that I could implement it for the rest of my team. The wipes themselves are really soft and I think kinder to patients' skin. So the soaps that we had in the trust at the times were the very small, non-soap really. They didn't foam up. You never felt that you were getting anything done properly. Water would go lukewarm, and as Fran said, you couldn't change the water because we were having to carry water from the bedside down to the sluice, which takes time. Also, there's the spillage aspect, so you know, frequently splashes of water on the floor causing slips. So it took away all of that for us. And I know Fran touched on the scratchy towels. I think lots of nurses know that drying patients with those scratchy towels was never very kind. So it took that away as well. And we were already using the waterless shower caps and had done for a long time. So in my mind, I started to think, well, what's the difference? Well, we've already got one system in place and that was working quite successfully. And the chlorhexidine wipes, I think, were a game changer in making sure that patients actually got their chlorhexidine washes in the right way. So for a lot of patients and a lot of nurses, they'd squirt the chlorhexidine into the bowl of water, which we know isn't the right way to do it. So actually using the wipes meant the patients got the right treatment and the right prevention of MRSA. I don't know whether Fran's got anything more to add.
No, I think I'd forgotten about chlorhexidine actually and the hippie scrub. So I think we found we hadn't, I don't think our infection prevention team had realised that the decontamination was basically being done with the hippie scrub into the water rather than the hippie scrub applied directly to the skin and then left for, I think it was 2 minutes and then washed off. And I don't think that was happening. So actually introducing the wipes made a difference to that, didn't it, Emma?
Most definitely. And, you know, from just seeing it happen on the wards, we could see that there was more compliance with nurses providing the chlorhexidine washes in the right way. So we've talked about how I said how much kinder it was to the skin. So patients that maybe had sore skin, not using the drying soap and water, patients would comment on how much nicer it felt being washed with the wipes. And then moving on to also the Contiplan wipes that were introduced at the same time, which we used for patients who were frequently incontinent or had some evidence of moisture damage to clean their skin. Patients didn't complain of pain. So when you add soap, you know, water even to damaged skin, it can cause pain, but actually the wipes were much kinder and we saw it less since using them, less instances of moisture damage. That's just me seeing what I've been seeing on the wards. I've got no proper evidence to back that up, but what I've seen is less evidence of moisture damage because it leaves the film of barrier on the skin.
Absolutely.
And then we sort of touched on COVID and nursing in isolation. We all know that, you know, you get everything together for a wash, but more times out of none that we always forget something. But actually, when you're donned up to go into either a room or a bay of patients all in isolation, to just have the wipes, to take them on in, and you've just got that one item rather than thinking about towels, soap, water, changing bowls of water. You're in the bay with your patients and able to just provide that care in a timely way. And without running backwards and forwards or having runners outside the room to try and collect your things. One of the things, so we've got the warmers where we keep the wipes warm on the wards, but obviously you take them out and they do cool down, and that was something that we worried about, cleaning people with what you might see as cold wipes, but actually they would either be warm or room temperature. But water in the bowls would, by the time you'd get to actually wash the patient, once you filled the bowl up, you set everything up, the water had gone tepid warm anyway. So it seems, you know, you're not washing with cold water at the end of the day. And it just seemed to be a success after all of our thoughts that this isn't going to work. We need hot soapy water for patients. It's not going to work. Actually, it's been a great success, and people moved over to it very, very quickly. Nurses, once they realised in the first couple of weeks of using it, how much easier it was for nursing time and patient care, it seemed to be improved because of it. It seems to have worked really, really well.
Brilliant. Thank you, Emma. I think Emma's put that in a nutshell. So from a really group of staff, especially our senior staff, when I took it first to one of the senior meetings and we were talking to some of the divisional heads of nursing within the trust, I got a very, very negative response. And even though I was negative myself, I was finding myself justifying why we should trial it. And it took a lot to get us to agree to a trial. And a lot of that was the free sample packs that we gave out to staff. And we just said to people, do you know what, let's not say it's awful until you've taken it home and you've tried it yourself. So we all took packs home, we all used them, we all washed with them and didn't shower for a day and to see what it felt like. And actually it was quite amazing. It was you did feel clean and you did feel fresh, and it was really nice. So I think that was quite a challenge to face all of that, but with a lot of education and a lot of explaining and a lot of actually discussing with the staff, who do they think is going to benefit? So a lot of staff were very much, oh, I have to get the bed wet, I have to make it really wet, and as I did as well, to be fair. However, is that me wanting to feel like I've given a really good wash, or is that the patient getting the best experience out of it? So when we were talking to the patients were saying to us, no, much prefer the wipes. Can I have the wipes, please? I don't want soap and water. So a lot of staff that were very against or a little negative towards the rollout, we were saying to them, just ask the patient what they prefer. Give them the opportunity to wash with the wipes. And if they don't like it, take in the soap and water. And I think that was, as Emma said, it was a good way to get the staff to think about what they were doing, and actually for them to take some ownership and learn along the way, taking feedback from the patients. So you've heard that we rolled it out in the trust, and to be honest, it's an extremely embedded system. We've got a really, the staff love it. In fact, we had a little bit of a supply issue recently, only because the orders had gone, something had happened with the orders, and the number of phone calls my team got saying, oh my God, we need these wipes, we need them now. So they're actually really, really embedded, and the staff rely on them a lot. So some of the challenges we faced to rolling this out, we thought that the challenge that we were going to face and have to overcome was the people being against using wipes. But actually it went a little bit further than that. So we had a lot of issues with the warmers. So the warmers have been supplied by the company. They're absolutely great. They sit on the wards. They keep those bed bath wipes warm. They work really well. They're not very big. They're like a little microwave, and the wipes have little sections to sit in. They're great. But I hadn't realised that we had to worry about having a mains overload, because that's a lot of more electrical appliances being used. So we had to go through our engineering department for that. We also had unexpected issues with people feeling very strongly about the environmental impact of using wipes. And I know that there are lots of things out there about baby wipes and how they're affecting the environment. And we hadn't really planned for this. We had thought about the fact that we were actually going to use less. So when you looked at using all the dry wipes that we've been using to wet and wash the patient with, actually the size of the pack of wipes and the pack of dry wipes and the dry wipes that we used was less waste. So we'd thought of that, but we hadn't actually had that next step in thinking about the environmental factors. And actually we had a very strong negative response from a lot of people. I got very accused of wanting to kill turtles and ruin the environment and the world for their grandchildren, and etc. And it was really interesting to hear that and to face that. And I think the company hadn't faced that before either. So I think there was a lot of working together to try to find out what was going on. And from my perspective, it was great because I actually found out that we are a neutral waste trust. So all of our waste, including our clinical waste and our general waste, goes to a facility and is burnt to make fuel. So we don't put anything to landfill at all. So the trust is completely environmentally neutral, which I had no idea of, but at least that helped people to stop those fears of us going a bit too far with the environment. Some of the other things that we were looking at was the fact that we were sending towels off to be laundered. We were sending a lot more sheets. We're finding when we were talking about washing the bed and making sure the bed was really wet, quite often you would have to change the sheets 2 or 3 times while you were doing that. So again, that's a lot of that's quite an environmental factor when you're going through lots of sets of sheets. And the other thing I think that we noticed from a tissue viability point of view is that a lot of our patients are wearing TED stockings or anti-embolic stockings, sorry. And often the legs weren't being washed, or people were washing what they thought they would wash and they weren't washing the whole patient. And the beauty of these packs of bed bath wipes is they actually tell you there's a wipe to do this and a wipe to do that bit and a wipe to do the other. And there's enough wipes to manage the whole body. And so it was really nice that the staff started using the wipes for that particular purpose. So we were getting a really good getting good usage from the staff, and also the patients were just really happy. And the wipes contain lots of moisturizers, etc. So they were just keeping the patient's skin much better and leaving it feeling better than the old soap did. And applying emollients afterwards wasn't always as necessary. So we weren't finding patients with as dry skin. So that's the bed bath side of it. And then we obviously, as Emma said about the ContiPlan wipes. Now the ContiPlan wipes are a wipe that cleanse, but they also contain a barrier product within the wipe. So you're doing 2 things at once. And it was really, really useful for us to see that the patients that had really painful moisture damage, and a lot of the time when the skin is really damaged, we get an awful lot of excoriation to the whole buttock area and to the groin. And these wipes, they're so soft. You can't tell how soft they are until you've actually used them, but they are so soft, and they leave that barrier product. So for us, we were able to implement a whole new moisture damage care pathway. So we didn't any longer have to use a secondary cream as well as having to wash and dry the patient. So with the wipes, you can air dry. So you allow the wipes to dry themselves. You don't have to dry the patient with a towel to clean them. And the one thing that we have noticed, and Emma alluded to it, and I don't know, Emma, if you agree with this or you've found this, is what we had been finding was a lot of splits at the top of the buttocks for our patients, a little bit of damage just at the top of the area around the natal cleft. And a lot of the time the patients would say, oh, it's ever so sore when they're cleaning me and they're wiping me with a towel. And I think that the wipes have prevented that. We're not seeing that as much anymore. Do you agree, Emma?
I would definitely agree with that, because I think the roughness of the towels and would just maybe scrape the skin, or just using the dry wipes. So the Contiplan wipes are just so soft. We've all had a go of putting them on our skin, and they really are incredibly soft and just leave a very fine film of sort of moisturizer, which then negates the need for adding extra emollients, which we found that quite often nurses would just really lather it on and leave thick layers on. So, and the patients would always say, oh, this is so much more comfortable, and you hear those less sort of wincy pain from the patients to when you would use soap and water, or even just water on their moisture damage.
Absolutely. And I think that's been a huge thing. And I don't think, to be honest, we had an awful lot of a challenge about the Contiplan wipes. I think the challenge was more when they were thinking that about the bed bath wipes. I think that's one of the challenges that we really faced. The Contiplan wipes were a much easier product to sell. As soon as people felt the Contiplan wipes and used them once with a patient, then they immediately started thinking that it was a much better process and a much better thing, a product for the patient's skin. So I think with the bed bath wipes, I think that was more of an issue to for us to continue and to get past. And it just took time and patience and letting people try it themselves. I think that was one of the biggest things. If you let people try it themselves, and you're not sort of saying this is what you have to do, but explaining it and working with them to see what the product is like, then you will, then we haven't really got any staff that have said that they don't want to use it. I haven't met anybody, and normally people are very quick to say if they don't like it. I don't know if you've come across anyone on your ward areas.
I've not heard any nurses say they don't want to use them anymore, or never wanted to use them once we tried them out and put them into place. And equally, I don't think I've ever had any negative patient feedback. Would you agree, Fran? I've not.
I think the only negative feedback I've had is about the fact that they can't get them when they go home, always. I think that is one of the issues for us, is that we do use them routinely now on every patient that comes into hospital. And of course, when I say that, if a patient particularly wants to, these are, I didn't make that clear earlier, these wipes are being used for patients that need to have a bed bath. So if a patient can get up and go and have a shower or go and wash themselves in the bathroom, then obviously we don't say to them, well, you can't do that, you have to use a wipe. These are for the patients that are bedbound and that need assistance with their personal hygiene. However, saying that, quite often if the patients can wash themselves and they're not having a shower, they ask for the bed bath wipes, because a lot of them have used them at an early stage in their stay, when they were a little bit more incapacitated, and then as they get better and they are able to get up and move around, they then still want to use the wipes. So quite often you will find them asking the nurses to grab them one out of the warmer when they go to the bathroom to have a wash. But they're used mainly for the patients that are bedbound. But we've really not had any comeback. It was that initial, I think it's that initial thought, you're going to use a wipe and that's going to wash a patient. And we're both completely there with people. So I know there'll be people out there now thinking, oh my God, this is going to be, that's ridiculous. You have to use soap and water. And that's exactly how we were. I can honestly tell you that we were saying, nah, this can't be right. Not every day as well. That's the other thing we came across, Emma, wasn't it? It's all right to use wipes just once or twice, but you can't use them every day.
Yeah, definitely. People would think that, but you couldn't use them every day. So it was, it took a lot of believing as a leader to bring your team along with you and to get them on board. And I think that's the key. You know, Fran came on board with it, had to lead with our seniors and then down to ward level and at the bedside. So really was a lot of leadership and getting people to understand and believe. So
yeah, and showing them. So I think you know, talking about the soap and water, you know, soap is, a lot of soap is very acidic. Its pH is not great, and so it's very drying for the skin. And I think sometimes we don't realize that. We think that soap and water is the best thing for the skin, but a lot of people don't use soap anymore. There's a lot of people that wouldn't use soap on their face, for example. But then if you're in hospital and you're being washed with soap, then you would be washed with soap on your face, but they don't like that, you know. So I think it was a whole change of culture. We had to give staff time to accept, time to think about it and come up with what they thought would not be workable, and then try to answer those questions. So I think if we were rolling it out again, I think we would very much look to getting lots of packs and giving it out to everybody, so that we could do that. The company were amazing and gave us loads of sample packs, so we were able to give them out to staff that were a little challenged by the idea. But the other thing I think was from an environmental point of view, and obviously Gama have been great at helping us to fight that, and they're also trying to improve their environmental packaging, etc., going forward. I don't know if you want to say anything about that, Carol, because I know you were facing it with me at the beginning.
It was one of the sort of big issues at the start of the rollout. But as a company, we are really striving to make our products more sustainable and workable as well in the NHS. So it is something that we are working on, so watch this space.
Brilliant. And, you know, I think the rollout took a while. I mean, when we're talking about this now, I did that first time emotion study in 2015, and it took me 4 years of discussing with different people, with trying to find the right products, with overcoming each of the barriers that we have already discussed about electrical appliances for the warming, the right wipes, and the cost, because it was very difficult. It's very difficult financially in any trust or in any organisation at the moment to bring in any change unless you're going to see a cost improvement or a cost reduction. And that was a big barrier that we also overcame, is trying to show that actually this is a cost reduction. And I think with all the workings for the cost of the bowls, disposable bowls, the dry wipes, the bars of soap, and then trying to put something together about the fact that the nursing time as well, we actually showed that it was cost neutral with a very slight cost saving, and that was a big push for us, and it meant that we could start taking this project forward and start taking it to the next level. But as I say, that did take us a good 3 or 4 years before we got to the point of actually thinking about rolling it out within the trust, and it's you know, it's still ongoing. So we still have new staff starting, so we have to make sure that we continue that education and we continue that support for the ward areas. We still have some staff that maybe that come in and they are very aware of the environment. So we have to keep reminding people, because when you've got new staff, then obviously that environmental impact is brought up again. So we have to keep putting out the information that it isn't going to cause a big issue. And then I think we're all living through this very strange time of COVID. And for us in the hospital, it's been, in this hospital, we've had, you know, a rough time, as everybody has had. But I think, and Emma has already alluded to it, but I'm sure again, I think that one of the biggest things during COVID was the wipes were amazing. Not having to waste that nursing time and also the PPE. So when you're struggling to manage the amount of PPE you have, and we've all had PPE shortages, there wasn't enough in the world for everybody because we all needed it all together. And I think when we were struggling with that nationally, not having to go in and out of a bay and take everything off, and if you've forgotten something, to have to strip it all off and to go out, and then the disposal of the water, you can't dispose it in the sink because we don't want, obviously with COVID patients and other patients, we don't want that risk of infection, and we'd found that was a problem in the sinks. So I think that during COVID, I think they've earned their weight in gold, really. I think they have been amazing. Emma, do you have anything else on that? I think they've just been great on the wards.
I think I'd agree with everything you said, Fran. I mean, just that not having to don and doff all that heavy PPE just to go and get one or two things, when you can just take your wipes in and you've got everything you need to wash that patient. Was again just saved so much time and for nurses, and actually meant the patients just got your time there and then, rather than dotting in and out and stripping your PPE off.
Absolutely. And also, with COVID, we've also found that their patients are getting a lot of skin damage, and also their skin is much more vulnerable to certain things and drying. So a lot of them have had to have very high flow oxygen and more medical devices, etc. So the wipes have been really beneficial with that as well. So they've helped us to ensure that we can manage their skin quickly and easily. And there have been a lot of patients with loose stool. And I think that's been a thing with COVID. We've had a lot of patients with very loose stools and diarrhea, and having those ContiPlan wipes have just been brilliant, because you don't have to worry about running out of the room to go and grab water, etc. You've got wipes. We can keep wipes outside the room. They're right there for people, and they're just so on the space. And the fact that they're providing a barrier at the same time, as you're doing good, even if you're trying to do it more and more frequently, you're giving that barrier without having to have other products there as well. And supply of products have been difficult during the time. So knowing that we've got the wipes available to all areas has been great, and it's worked really well for all of us, especially in our intensive care unit. Have used them widely throughout, especially with prone patients as well. Trying to clean prone patients is quite a challenge, but actually when you're deproning or you're doing a change of position, it's really been easy to quickly give them a wash over with the wipes, rather than having to get them with the water and then to dry them. So that's made a massive difference in intensive care and in the prone patients, because obviously a lot of those patients had pyrexia and were very hot and sweaty. So having to be able to give really good care in really stressful situations with very limited time and limited staff, the wipes have helped. Without a shadow of a doubt, they've helped us maintain really good skin care for our patients, and we've had very little damage to skin on patients in intensive care, and that has been, that's amazing for us. We can contribute a lot of that to the fact of the system that we're currently using with the wipes.
Can I just make a comment there, actually, Fran?
Yeah.
Because Gama kindly gave me back to the NHS twice to work in the Nightingale in London, and the first time it was all ITU, and we had no water at all. We had one sink per 42 beds, really for emergency reasons. So the whole thing was patient wipes, and the patient's skin did extremely well. I don't know what we'd have done without them. I have to say they weren't Clinol products either, because I absented myself from all procurement decisions. Now, I think you actually wanted to talk about patient experience a bit, didn't you?
Yeah, I have to apologise because we did advertise that we were going to have some patient stories. But unfortunately, one of the patients that there's two particular patients that were going to give us a story. And I haven't been able to manage to get a video of either, but I'm just going to tell you a little bit about them. So one particular patient is a lady that's been in with us who's in her late 30s, who's had vulval cancer. And there's a lot of moisture and discharging in that area. And she actually was in an extreme pain. They were putting a lignocaine gel on to the area, and that was hurting her. She was on very strong painkillers. We were trying lots of different things to try and topical morphine as well. The nurse, the doctors had tried because she was in so much pain. I went to see her and we took her a pack of the Contiplan wipes when we were rolling them out, and she cried. She literally cried and said, I want to tell everybody about these things because this is just changing my life. She was able to cleanse herself again. She didn't have to keep relying on other people coming with different products. So it really made a massive difference to her. And you'll all have, seen patients that are in so much pain with their damage, especially in the perineum and the perianal area. It's just excruciating. So that's been really great. And again, it's not having to dry; it's letting it air dry. And then the second one, which is a bit of an unusual one, because these wipes are for adult patients. So we've rolled them out for adults because they're not licensed for use on pediatrics, because it's so difficult to do the studies and get that approval and that for little ones. But we are using them on pediatrics in certain circumstances. And what we do as a trust is we speak to the parents and we explain that they're off license, they're not licensed for the children. And if they're in full agreement, then we will give them to trial, we'll monitor, and if there are any skin reactions, we would obviously stop, but we haven't had any skin reactions. And at the moment, we've got a young girl who's got leukemia and is having chemotherapy, and she's 12, and going through that very difficult age of a 12-year-old girl, and she's got an awful lot of moisture damage in her groins and around her genital area and around her bottom, and she's so embarrassed, doesn't want anybody to see it, doesn't want it touched, and is having loose stools quite frequently. So I went up and spoke to her mum and I said, would you like to try these? And she was very happy to. So she tried them and she called down and asked me if I'd go up. And I went up to see her, and she just was crying and said, this is just the best thing ever. And funnily enough, she's a carer who works in a residential home, and she's already phoned the residential home manager and told her they've got to buy these because they are going to be amazing for their residents. So I think for her as well, it would have been great for you to hear it from her mouth and not from mine. But she really has found the difference because of it's really nice because they're quick. You can maintain that privacy and dignity for the patient at the same time, and that's really important. And although for children you would have to think about very young children, we've used it on a 6-year-old, a few 10-year-olds, and sort of in that age, no younger than 6, but it has worked amazingly. And as long as you're giving all of the information to the parents and you are ensuring that they're making an informed choice, then we have moved forward with that. So it's been absolutely brilliant, the whole rollout. And again, the challenge is for pediatrics is they want the wipes and we can't give it to them. So that's our next battle to challenge, and maybe putting a process in place to ensure that staff can use them without having to come through my team first, so that we don't have to go and see the patients. They can just give them to certain age groups. So that's something that we need to work on in the future. But at the moment, as both Emma and I have been saying, the feedback from patients has been brilliant. They absolutely love them. We haven't had any negative feedback. The only negative we had at the beginning was the staff, and now we don't really get negative feedback from them. Now it's out there and it's being used all the time. So, Martin, have we got lots of questions?
We've got so many questions. Honestly, it's been, and there's a lot of excellent questions. So I'm really just going to take them through in order, if that's okay. So first one's from Charity. Can you introduce waterless bathing to domiciliary? Because there are service users in their own home. Somebody want
Can't
to take
see
that
why
one?
not. Why not? It's not. If it's easier and the patient, I always call them patients. Sorry, I know in domiciliary care you probably call them clients, but I'm a nurse in the hospital, so it's old school. But if the patient would like it or the person would like it, if you give them that choice and let them try it, I don't see why it can't be rolled out anywhere, to be honest.
No, I mean, I've got personal experience of that, of a relative at home who we wouldn't have coped without waterless bathing, to be absolutely honest, because he wasn't going to tolerate going in the bath or the shower or anything like that. No need to dry afterwards. I think you covered that. What about skin folds? Sabina asks.
Oh, great in skin folds. It dries really quickly, and actually quite often what we will do in the skin folds is use the Contiplan wipes as well, because quite often in skin folds you'll get a little bit of moisture damage sometimes. So we just wipe on with the Contiplan wipe, and then you would hold the skin fold open for a little while, and it dries quite quickly, and then you would just let it go. So yeah, absolutely, it works really well.
Okay, a question from Jill about using heat to warm them up. Does that affect the moisture level within the wipe? Carol, do you want to take that?
Yeah, no, just to reassure you, the warmers don't dry out the wipes at all because they're obviously sealed, so there is no drying effect. And it's only the bed bath wipes that you put into the warmers. Obviously, the Contiplan wipes you're going to be using constantly, so you wouldn't rewarm and cool a wipe at all. So it's just the bed bath wipes and the Chlorhexidine washcloths that they currently use the warmers for.
Thanks very much. Simon asks about how you compare with giving a bath or shower. They may gain benefits from being immersed or showered during warm water. Have you got any comment on that, Fran?
Well, once again, if we could shower the patient, then we would. So if the patient wants to go in the shower or can go in the shower, then we would encourage them to do so. I think this is for those patients that are in the bed and can't get out. So either bedbound patients from a mobility point of view, or patients that are attached to 25 drains and a few drip stands, etc., or high flow oxygen, or having plaster casts on, or different things like that. So I think this is mainly for that. There is still, if we would still encourage patients to shower if they're able. I think it's just for those patients that can't. And there is, bathing is a great thing, but unfortunately in the hospital these days we have very few baths and very few patients that would be able to get in and out of the bath. So showers are the way to go in hospitals these days, and we would still encourage that.
Yeah, completely agree. So Emma mentioned there was less moisture damage anecdotally during the barrier film, and actually there was a paper from Beekman in 2011, I think, showing there was less moisture damage with a barrier type cloth. It asked what's the barrier substance within the wipe, and that's Paula, as I said. Carol, the barrier substance?
You've got dimethicone and liquid paraffin in these wipes, which acts as your barrier.
Okay, question from Julia. Do you use the wipes throughout all departments in the hospital, Fran? Yep,
everyone, every adult area. So it's gone throughout the whole place. And there were some units that we'd spoken to that used it just in a couple of areas, and in some hospitals, but we decided to, if we were going to do it, we were going to do it throughout the whole lot, because our patients move so frequently, and what we didn't want to happen was them to have different standards of care on different areas. So we roll it out. The only areas, as I say, we don't use it standardly is in our neonatal and in our pediatrics. We use it in maternity as well. We have a maternity unit. We use it in our maternity unit, and the new mothers, if they can't get out to the shower following C-sections and things to start with, they love it as well. Okay. It's great because they can stay with the baby when they're having the wash and they don't have to leave them. And quite often when you've got your newborn, you don't want to leave them even to go for a shower. So, it's been great. So yes, we use them in all departments.
Yeah. Sabine's asked it's 1 pack of per wash per person. Is that right?
Yeah, so they're individual packs and they contain 8 wipes. And the wipes are, there's a thing on the back which tells you, I'm just going to read it because I've got
Which
it
bit to wipe
next to
with
me.
one?
Yes, so there's 8 cloths, one's for the face, neck and chest, one's for the back, one's for the right arm and armpit, the other's for the left arm and right armpit. Number 5 is for the groin and the perineum. Number 6 is for the buttocks, number 7 for the right leg, and number 8 for the left leg. So it gives you a very clear indication. You just use that one wipe in different areas. It's 1 pack per patient, per bed bath.
Thank you very much. Did you have any problems with patients who are allergic to any of the wipes?
We haven't come across any allergies yet. So we haven't had any patients that have an allergy. I'm not saying that won't happen, but sure. as of yet, we haven't had anything, we haven't had any reported yet.
Okay. Jay's asked, how many wipes would you need per person being washed? You've just covered that with the 8. Environmental and cost implications, I think you've covered in the talk. Sensitivity to chlorhexidine, well, I mean, we do know some people are sensitive to chlorhexidine.
Absolutely.
So do you have an alternative if there is a sensitivity to chlorhexidine?
There is an alternative, and I can't remember, Emma, you might remember more off the top of your head, but it's another lotion that is, isn't it? It's Dermal 500, I want to say, but I might be wrong. There is something else that's used as a protocol. I think it's Dermal 500, isn't it?
We use Dermal 500 if you can't tolerate chlorhexidine, yeah.
So that was the same if they had the allergy to Hibby scrub. And of course, the chlorhexidine wipes are much nicer to the skin than the Hibby scrub was if it was being used properly. So we're probably, as Emma said earlier, getting better levels of decontamination for the patients anyway, and with it being much kinder to the skin at the same time.
Yeah, I mean, you made a very good point about the dropping a bit of chlorhexidine in a bowl and, diluting it so much. That's called homeopathy, and it's really unlikely to work, I don't think. Jay made an excellent point as well. There's a bit of, there's a protective film if you're using something like Contiplan from the wipe. So what about people needing low adherent dressings due to soiling and stoma patients? Any issues with that you come across?
None at all. And that was one of the things that I trialed right back at the beginning before we did the wipes, because previously we were using a barrier substance, and quite often, to be perfectly honest, when they'd had that applied all over their body, I couldn't stick anything to anywhere. And especially if they had a sacral pressure ulcer or a sacral wound that I needed to dress, I wanted to ensure my dressings could stick. So no, they do not cause any issues at all. And we use a silicone adhesive in the trust as well, which obviously are great for the skin, but don't always adhere as well as they could, and we don't have any issues whatsoever.
Okay, thank you. There's one here from Ana Rita Fernandez Pereira asking about any studies regarding the use of chlorhexidine wipes and infection rate reduction. I'm going to take that one. And I'm going to say, how long have you got? I've got to be honest, because there are gold standard randomized controlled trials that talk about the use of chlorhexidine in reducing central line associated bloodstream infections, all bloodstream infections in critical care, and surgical site infections. If you look at the Cochrane review, it says there's no evidence, and that's because if you look at the criteria for the Cochrane review, they specifically exclude wipes from the review. And all modern preparations, or a lot of modern preparations, are wipes, so they actually don't look at any of those studies. So there is guidance in the UK called EPIC 3, which suggests that you should use chlorhexidine bathing in critical care. But many people, aren't aware of that EPIC 3 guidance, and that is the National Infection Control Guidance, or they just don't do them. So there are studies coming out of your ears. If you just search Susan Huang, who's an American professor, and look at all of her studies, we've got really good randomized controlled trials on use of chlorhexidine wipes and infection rate reduction. The one thing I would say, somebody asked about decreasing Corti rates using waterless bathing. I don't think there's anything on that. There isn't even on the chlorhexidine bathing of the body, but Professor Brett Mitchell in Australia has done a study recently on chlorhexidine cleaning the meatus before passing a catheter with only 0.1% chlorhexidine, and he got a statistically significant reduction for that, but that was a specific type of intervention aimed at pre-catheterization, so not bathing per se. So anyway, I'll climb off my soapbox now. So
I'm glad
next
you
one,
took that one.
Yeah, it's infectious control notes, can't help. So Charlotte Lloyd-Jones asks, following on from the domiciliary care question, what's about the expense? Because they're using Conti wipes for infection prevention and making sure there's no rough flannels and sponges on fragile skin. So what about the overall cost? How could you equate that, do you think, Fran?
In domiciliary care?
Yeah.
That one I'm not 100% about, but I presume that the patient would be able to purchase them if it worked for them. So if they can purchase it and it's cheaper than them buying things, or they like it and it's better for their skin, then they don't have to buy their own emollients. Because I think that's one of the things, Emma, I don't know if you agree, but we've had to use less emollients on the skin because the wipes are so moisturising.
I would definitely agree with that. A lot less emollient is used, which is definitely a cost saving because the wipes do leave the skin so soft.
Okay,
so
next question.
I think that's what would happen, yeah.
Next question from Emma Bate. How does this work when managing patients with incontinence? For example, patients in critical care where many wipes are required during bed baths to clean fecal incontinence away before an effective bed bath can be given. Would we end up using both products? What's your experience of that?
Well, we use both products anyway. So we would clean up using the Contiplan wipes, and then we would give the patient the bed bath with the bed bath wipes. So we would use both products simultaneously, depending on what situation you found yourself in. So absolutely, our critical care department used the wipes and really like the wipes and haven't had any issues. So I don't think there's too much. In fact, they were the biggest number of phone calls when we didn't have any for a little while. We had a shortage for a couple of days and they were not happy at all. So, and also at one point we got delivered the wipes from a different company, and also there was an awful lot of discussion about that, and that wasn't the right thing to do. So I think our critical care would definitely, if you work in a critical care area and you wanted to speak to our critical care area about the wipes, they'd be more than happy to discuss it with you. I'm sure, because they are really happy with it.
Okay, thank you. Natasha Webb's asked, can the wipes be used for washing legs in primary care? Now, the washing is, I'm wondering if that relates to leg ulcer management or something like that. What do you think about that?
The thing is with leg ulcer management, if it's in primary care, if it's in a GP surgery, or it can be much more difficult because, once again, there's been a lot of issues with the disposal of the water following the washing of the legs. And I know locally the community nurses have in practices, etc., have really struggled to find new techniques for washing and new things for bathing. I mean, the wipes would clean the leg. I'm not sure that they would take off all the dry skin, and I don't think anything would be a substitute for soaking it. But they could be used on patients that don't have a real issue with dry skin. But obviously, I'm basing my experience on the hospital, but that would be something that would be very much worth trying.
Yeah, if I can just jump in on disposal of water after washing, actually, or anything like that, just putting a little plea with my infection control hat on, please don't put it down the hand sink, okay, because there's lots of outbreaks now being written up about, what goes down the sink comes up again, okay, and the whole point of washing your hands is to actually wash the bugs off your hands, and they go down the drain. But then what happens is we chuck old cups of coffee down and other nutrients and IV bags, and then the biofilm grows, so you'll get a lot of slime in the bottom of the trap, which then comes up again. And if it splashes, and there's good studies show anything within 2 meters of a hand sink gets splashed, all the multi-resistant bugs that down the drain come back out again. So just another little mini soapbox there. Okay, next one.
That's actually, Martin, that was the reason that we started looking at this in the first place, is because our sinks in the bays, there is only hand sinks in bays. So you've got a bay of 6 beds and a hand sink. And they weren't able then to throw the water from washing the patient down the sink, especially if they'd been doing personal care or cleaning up incontinence, etc. Then obviously that's what infection prevention in the trust said, that you can't do that anymore. It has to be disposed of in the right place in the sluice. And that was what was causing the nurses so much extra time, but also difficulties, because you're carrying a bowl of water down the corridor to try and
Yeah.
dispose of it. And actually, as Emma said, lots of slips and trips and splashes on the floor, which is not great on a busy ward. So
No.
absolutely.
I don't want to get too hung up on this, but do you know what percentage of activities at a hand sink is actually hand hygiene? Because in America, they put a camera over the top and just looked at what people were doing, not the person themselves. And actually, the number of activities at a hand sink that are actually hand hygiene is 4% of all activities. The rest of it is us putting nutrients down or using it to put stuff in. Anyway, that's another soapbox. Are the work wipes perfumed, Sabine says?
No, I don't think no, they don't really smell. There's not really a smell to them.
No.
Okay.
No.
Natasha asks,
tested.
Sorry.
yeah, dermatologically tested, yeah. Natasha says, can they be ordered by district nurses in the community?
They can be ordered by anybody, I would imagine. I'm sure you can get them, you can buy them. I'm not sure, can they come through other routes, Carol?
As it stands at the moment, they're not available on FP10, but they can be purchased through many distributors that are out there. They're also on NHS supply chain, so if you can access NHS supply chain, that's another route. But please feel free to contact us and we can advise and direct.
Yeah. Liz asks, are all the wipes with chlorhexidine only or only with bathing MRSA patients? I'll do that one. Chlorhexidine really for the MRSA patients because you're trying to decolonize them. There are some also evidence that it does help suppress other organisms on the skin as well, like Candida auris and some of the multi-drug resistant gram-negatives, but the rest without the chlorhexidine is fine for washing. Ashley Sampak, good question, this one. Do these wipes work on thrush-prone patients when emollients are used instead of soap, Fran?
Well, we use it on patients that have thrush, and if you're just cleansing them, actually it's probably more comfortable for them as well, because it's not particularly comfortable when you have a fungal infection. So we have used them, and we have used the Clinell wipes to help give a barrier, but we would obviously, if it's in that treatment stage, we would ensure that the treatment was given.
Okay, question from Karen on Facebook. In the home, could they be heated in a different way for domiciliary use?
I'll leave that to you, Carol.
They can be heated in a microwave, but literally for 5 to 10 seconds, that's adequate to do so.
Okay.
And then obviously test them before you put them on the patient.
Yeah.
Definitely, yes.
Yep. Any trial, this is Henrietta, another good question. Has there any been trial on long-term use of the wipes on skin integrity, say 3 to 6 months, a year, etc.?
Yes, well, we've been using them for how long, Carol? 2 years now?
Probably about 18 months now, isn't it?
It's about 18 months we've been using them, and we haven't seen any effects. We've had, although we don't get many, we do get a lot of patients that are in for long periods of time, and that has been even more evident during the COVID pandemic. So we've had a lot of patients that have been in for months and months, and some actually nearly a year, and we haven't had any issues with skin problems from that point of view. I don't know, as a company, whether you've seen any issues.
We haven't had any problems reported to us at all.
Okay, and Sally Ann Spencer Gray, are these wipes appropriate for those receiving radiotherapy, i.e. metal-free, etc., to use in the areas being treated, exit dose, etc.?
Yes, we've been using them and we haven't had any issues. I think with radiotherapy, it is anything containing petroleum, isn't it, that you can't use. So Vaseline type products you can't use, but these have been absolutely fine. The bed bath wipes don't contain anything like that, so they're fine. Okay, well, it's 6:01, so we have to draw to a close. And thank you so much for all the questions. And you know, there's people to contact in the chat if you want to find out any more information, or you've got more questions, or if you're sitting at home tonight and think, I wish I'd asked that, please come back to us. We'll all be happy to take your questions. I've really enjoyed the session, and I'd just like to thank Emma, Carol and Fran for a stimulating session. If you're watching this on catch up, feel free also to contact us, and TVS will give you the contact details. And thanks to TVS for organising this, slick as ever, and it's a great pleasure to be working with you again, I have to say, after a number of years. Thank you very much, everybody. Thank you.
Thank you.